receptor depends on two factors: duration of the stimulation, intensity of the stimulation, right? But the thing is that not all receptors are the same. Okay? So, when you press the Pacinian corpuscle and keep it, the Pacinian corpuscle only responds at the beginning of the pressure. Then it stops. We call this adaptation. Okay? So, consider this. We have a pressure or a stimulation, anything. Okay? It might be light, pressure, pain, everything. Then you continue the stimulation. So, some receptors respond like this. With the start of the stimulation, they start action potential, and they continue to have action potential as long as the stimulus is there. But there is only a decrease in the frequency. At the beginning, they generate more action potential. But when the stimulus goes on, the response decreases a little bit. But it continues to fire. This decrease in the firing rate is called adaptation. So, adaptation is this. Discharge of progressively slower rate of action potential over time in response to constant stimulus. So when you have constant stimulation, firing rate decreases over time. This is called adaptation. So this receptor adapts slowly. This receptor adapts rapidly. So the stimulus starts, it generates action potential. So what's wrong with it? Okay. So stimulation starts, it generates action potential. Is the phone here?
No.
Okay, for the third time. Stimulus starts, response also starts. Stimulus is still on, but response is off. So we have rapid adaptation, rapid decrease of the firing. Okay, firing is rapidly adapted and also it's completely adapted. It stops firing. So adaptation here is a slow but continuing. Adaptation here is very fast and complete. So we call these receptors slowly adapting, SA, slowly adapting. These receptors are called rapidly adapting, RA.
It's kind of fatigue?
It's not fatigue. Fatigue is when a cell doesn't respond to another cell because of the loss of the resources. Okay? But here, the mechanism is different. Adaptation means actually a reduction in the firing rate. Okay? So, let's compare 4 different receptors. The first one is, for example, let's see this one, joint capsule receptors. Right? For example, consider a joint like elbow. Okay? You bend the elbow, receptors are activated. And you keep the elbow bent. Okay? Flex, I mean. So, at first, when you are moving the elbow, the firing rate is very high. 250 action potential per second. Right? Then you keep the elbow bent, firing rate decreases little by little. But it continues to fire as long as you keep the elbow bent. Okay? Muscle spindle, another receptor. For example, it's inside all of the muscles that you have. Okay? So, you stretch a muscle, the length of the muscle increases, so we will have action potential in the muscle spindle, right? At first, it's very high. Then you continue to stretch. I mean, you hold it but firing rate decreases gradually, but it reaches a constant level. Okay, so we have adaptation, the reduction in the firing rate, but adaptation is not complete.
Slower.
Yeah, but consider the hair receptor. So any hair on your skin. If you move these hair, you can feel them. They function as a receptor, right? So you move the hair and keep it. At first, it generates action potential at a very high rate. Then in 1 second, it stops time. It rapidly adapts and completely adapts, right? Pacinian corpuscle. You press the Pacinian corpuscle, in a fraction of a second, it completely adapts. So it's very fast and complete. So, Pacinian corpuscle, hair receptors are rapidly adapting, joint capsule receptors, muscle spindles are slowly adapting. Did you get this point?
Yes.
Good. So, thermal receptors are also rapidly adapting. You go out of this cold room, okay? And when you go out, at first, you feel the hot weather, right? But after some minutes, you are adapted, right? You no longer feel the hot weather, okay? So it's actually the result of the adaptation that happens at the level of the receptors and also at the level of the brain, okay? But for now, we are focusing on the receptor. So at first, temperature receptors fire very rapidly, but then they decrease the firing completely, okay?
What about the pain receptor?
The pain is different. Pain is generally slowly adapting receptors, but sometimes they, instead of adaptation, they are sensitized. So when the damage continues, firing rate increases instead of decrease. Okay? So instead of having adaptation, we have sensitization. But generally, they are categorized in the slowly adapting receptors. Sometimes we call them non-adaptive receptors. So, slowly adapting receptors are also called tonic receptors. They continue to transmit impulses to the brain as long as the stimulus is present. They detect continuous stimulus strength. And these receptors are slowly adapting. Muscle spindles, Golgi tendon apparatus, receptors of the macula, in the vestibular apparatus, pain receptors, valve receptors, chemoreceptors of the carotid and aortic bodies. So all of these are slowly adapting. You should remember these, you should memorize this. And so tonic receptors are slowly adaptive receptors, right? 3 different names for the same receptor. Now, we have rapidly adapting receptors that are also called rate receptors, or phasic receptors, or movement receptors. Usually we say phasic receptors. So they are stimulated only when the stimulus strength changes. Okay? What does it mean? I told you that if you start the stimulation suddenly, continue it, and end it, right? What happens for rapidly adapting receptors? At first you will have action potential, then it will stop.
We change it.
Yeah, stimulus is present, but we won't have action potential, right? But if instead of having sudden increase in the stimulation, we have this type of stimulation. Okay? For example, you are pressing the skin and you slowly increase the pressure. Okay, what happens? They start firing, they continue firing, and after the stimulation is fixed, they stop. So they fire as long as the stimulus is changed. This is the feature of rapidly adapting receptors, right? So slowly adapting receptors fire as long as the stimulus is here, but at first with more intensity. But rapidly adapting receptors stop here. These receptors can only be activated when you have change in the stimulation. So they react strongly while the change is actually taking place.
Change means
So
both increase and decrease?
Both of them, yeah. Yeah, both of them. So, the importance is prediction. Okay, prediction for the brain. So when the brain sees that, okay, pachycean corpuscles are generating action potential and it's going on and on, it means that there is a change in the receptor intensity or the pressure intensity, okay? So it's not a fixed pressure. So for example, you cannot see something is touching your back, okay, I mean the brain. But pachycean corpuscles continue to fire. What does it mean for the brain? For the brain, it means that the pressure is getting higher and higher. Right? But if something touches your back and the brain sees that, okay, a few action potential arrived, but then they stopped. It means that actually the touch happened here, but it's fixed. It is still there, but the intensity is the same. If you remove the pressure, again, you will have another course of activity. Okay? So, some receptors respond like this. At the start, they fire. At the end, again, they fire. So they signal the beginning and the end of a signal, not the duration of the signal. Okay, so let's summarize.
Sir, can you say that rapidly adapting receptors are for proprioceptive functions? Proprioceptions?
Proprioceptions? Yeah. Proprioception means receptors that are involved in detecting the state of the body. A lot of proprioceptors are rapidly adapting. So pachycean corpuscle is a type of proprioception receptors, right? But not all of them are rapidly adapting. Some of them are slowly adapting. We will see that in the next session, okay?
Why there is need to adopting the action potential of receptors?
Sorry again?
Why there is need of adapting all receptors?
Why do we need that?
Why need this?
So, actually, the brain needs this information in order to have a proper understanding of the body and the external world. This is the question. This is the answer only. You know? So, sometimes we need to know the continuation of a signal. Okay? But some other time, we only need to know the start of something or the end of something. So this is the quality of the brain. Okay? For example, I mentioned this in your first session. I told you that you're sitting here, you ignore the pressure of your body on the chair. Okay? Some of the receptors continue to fire. So when you sit here, they started to fire, and now they are firing. They continue firing until you are sitting. Okay? So the brain receives their information. But other receptors only responded at the beginning of your sitting position. Okay? Then they stopped. So the brain uses all of this information to have a proper understanding of the state of your body. Okay? So both of them are necessary for the brain. So, let's summarize. We have different receptors in the body. Some of them are mechanoreceptors, other thermoreceptors, electromagnetic receptors, chemoreceptors, right? And nociceptors. Each receptor only responds to one type of a stimulation. And each receptor uses nerve fibers to carry the signals to the brain. All of these fibers have action potentials. So an action potential in a nerve may mean pain, in another nerve may mean touch. Okay? So that's why we call that, we say it's a labeled line principle. Okay? So, all receptors generate receptor potential. they convert stimulation into electrical potential, which is called receptor potential. The receptor potential is necessary for having action potential. Action potential happens in the first node of Ranvier. So all of these are the main important issues that you will have in your exam, okay? So the first node of Ranvier is the place of having the first action potential. In synapse, the initial segment of the axon was the place of action potential. Here, first node of Ranvier, right? So, there is a relation between the intensity of the stimulation and the duration of the stimulation with the frequency of action potential. There is no relation between these two and the size of the action potential, or the duration of action potential, right? Or the threshold of action potential. So the only aspect of the action potential which responds to the stimulation is frequency, right? Some receptors respond to constant stimulation, but with a small decrease in the firing. We call them slowly adapting. Some other receptors only respond at the beginning or at the end of a stimulation, right? We call them rapidly adapting. Slowly adapting receptors are very good for detecting continuous signals. But rapidly adapting receptors are very good at detecting changing stimulation, right? Rapidly adapting receptors can be used for prediction. So the rates of change can be detected by the brain. And the mechanism of adaptation is different. Okay? So each receptor has its own way of adaptation. So we talked about Pacinian corpuscle. I told you that it's a rapidly adapting receptor. What's the mechanism? I told you that we have a capsule, the nerve bit inside the capsule, right? And it's filled of a fluid, right? When you press the capsule, you will have a change of the shape, right? So the fluid inside distributes, redistributes. So because of this redistribution, sodium channels doesn't respond to the constant stimulation. You have a capsule like this, you press here at this point. So you will have a change of shape, right? So fluid inside is pressed. After some milliseconds, the fluid redistributes, right? So it cannot activate the sodium channels after this. So this is a probable mechanism of adaptation. Another explanation for adaptation is accommodation. Accommodation means sodium channels are inactivated. So sodium channels at first respond to the pressure, but then they don't respond. Okay? Because of the inactivation, we may have adaptation. So adaptation in the Pacinian corpuscle may be the result of redistribution of the fluid or inactivation of memorize these factors, okay? So after the end of this course, you will have a pile of information about the CNS that you should keep them in your mind all at the same time, okay? So you should be able to relate materials from your last session with the material from the first session, because the CNS is like this, okay? It's different from, I don't know, liver, kidney, GI, I hate them, you know? So try to study more and keep them in your mind and relate all of them together. And you should relate also physiology with anatomy and also histology. Okay? Shall we continue or should we stop? Stop? Continue?
Yes, sir.
So, receptors use nerve fibers. So, where do we have the soma of these cells? You say? The soma of the somatic receptors. Where is it located?
Skin.
In the skin.
Muscles. Soma in the brain.
Where is the cell body of the receptors? I mean, somatic receptors. Touch, pain, muscle length, joint receptors, all of that. They have soma. We didn't see the soma. D or G?
Yeah.
Okay, so a piece of skin or a piece of muscle or a joint, okay? So we have a receptor, you say the name, okay? It's maybe Pacini or maybe Rafinha, everything. So it has an axon which is myelinated, right? It has a soma, cell body. It has the second axon. Then we have a spinal cord. If you cut the spinal cord and get it out, you will see something like this, right? Can you see this? Okay, gray matter, white matter, right? So, I don't want to say that where this cell goes, okay? Ignore this part in the next session. For now, let's talk about this, okay? So, this is the Pacinian corpuscle. It's sensitive to pressure. Action potential is generated here. Then it jumps to this point, then it goes to the soma, then goes to the spinous. All of the receptors in the somatic sensory system have their somas in them, D, R, G. Okay? I may ask you something like this. Where the cell body of sensory afferents are located? Sensory afferents. Okay? Yeah, afferents. Thalamus, or let's say ventral posterior nucleus of the thalamus, gracile nucleus, dorsal root ganglion, trigeminal nucleus. Dorsal root. Actually, trigeminal nucleus is also correct. Because touch from the face doesn't go to the spinal cord. It goes to the trigeminal nucleus, brain stem, through the cranial nerves. Right? So, let's keep on our topic. All receptors use nerve fibers for carrying signals. Fibers can be myelinated or unmyelinated. Myelinated fibers are called A fibers. So, A fibers, myelinated. Unmyelinated fibers are called C fibers. So, we have type A fibers, type C fibers. A fibers are myelinated, C fibers are unmyelinated. A fibers can be divided into 4 classes based on the thickness. The thickest one is A alpha. Then we have A beta. Then we have A gamma. And finally we have A delta. So which one is the thinnest myelinated axon? A alpha, A gamma, A delta, C.
C.
Which one is the thinnest myelinated fiber? A delta. C is the thinnest one. But it's unmyelinated. Okay?
Yes, sir.
So this is the way I cheat you on the exam, you know? Which one is the thinnest myelinated axon? A delta. So,
Delta?
The thinnest myelinated axon. So, thinnest myelinated axon means this. Okay. What's the importance of these fibers? Those that are myelinated are faster than unmyelinated. So A fibers are faster than C fibers in transmission of action.
Speed of condition.
Yeah, velocity of conduction. Conduction velocity, right? So, between the A fibers, which one is faster?
Alpha.
Yeah.
Alpha.
Which one is slower?
A delta.
You can see the diameter here, okay, and the conduction velocity here. 120 meter per second for A alpha fibers, 120 meter per second, okay, and 6 meter per second for A delta fibers. From 0.5 to 2 meter per second for C fibers. So, if you have pain in your toe, okay, and you have a height of 2 meters, it takes you 1 second to feel the pain from the toe. Because pain, chronic pain is conveyed through C fibers, right? So your height is 2 meters, so it takes you 1 second, maybe, for feeling the pain. Okay, so after 1 second you feel it. But if a touch happens on your toe, you will feel it in a fraction of a second. Because fibers that carry touch has about 80 meters per second velocity. Okay? So, you can see here different types of sensations that are carried by different fibers. For example, tickle. Okay? This can vary through C fibers. Aching pain. Chronic aching pain. This can vary through C fibers. Warmth. Most of the warmth is can vary through C fibers. There are also some A delta fibers that carry warmth. Okay? Cold is mainly transmitted through A delta fibers, but some of them also through C. Now, muscle spindles, stretch of the muscle. This can vary through A alpha. Right? So different sensations are transmitted through different type of fibers to the brain. Generally, myelinated fibers are faster, right? And the thicker the fiber, the more the velocity is the velocity of conduction, right? Did you get this?
Yes.
So, one way of classification is like this. A, C. A alpha, beta, gamma, delta. Another type of classification is dividing the fibers into type 1, 2, 3, 4. 4 equals C. Right? 1 equals A alpha. Let's see the third one.
A delta.
3 equals A delta. But 2 equals both A gamma
beta, gamma.
and A beta. So it's here. Actually, we have 2 type of one fiber. 1A, 1B. Okay, both of them equals A alpha. Group 2 equals A beta and gamma. Group 3 equals A delta. Group 4 equals types. So I may ask you before in an exam, which type of fiber carries aching pain? Type 1A, 1B, 3, 4.
4.
4 equals C fiber. Okay? But remember, this type of classification, I mean dividing them into categories 1, 2, 3, 4, is only used for sensory fibers. You cannot use this for motor nerves or motor axons. Okay? So this is a specific classification only for sensory fibers. But this is general classification. You can use A and C fibers, I mean this nomenclature, for both sensory fibers and motor.
So even if in the option you will give the motor function, we are not supposed to,
Sorry, I didn't get your point.
for example, if you give any option which is having the motor function for C, you
Yeah, actually I mentioned that, For example, I may ask you that, okay, for moving your leg, okay, which fiber is involved? A alpha, A beta, type 4, type 3. A alpha, because motor commands are carried through the fastest type of the fibers. Okay? Yeah. Skeletal muscle. So yeah, motor function. Very good. Sympathetic information goes through the symphyte. Muscle spindle. So we have for muscle spindle we have both of them, A gamma and A alpha. Okay. Sorry. We have two different types of motor neurons in the spinal cord. Alpha motor neurons, gamma motor neurons. Right? We don't have delta motor neurons. We don't have beta motor neurons. We have only alpha or gamma. Okay? So, where can we stop?
yes, sir. So the line